Okay, so today we're going to do a practice very dissimilar to Monday's practice, where we focused a lot on breath. Of course, always focus on the breath. But today we're going to do a little work with joint mobilization. So, what is joint mobilization? Why would we want joint mobilization? And how is it different from, the classic realms of stretching? So, it's different when you stretch and hold a muscle in a elongated stretch. This is beautiful and really good for you, resetting set points for your muscle length and um, so much good things. But that's a little different than joint mobilization. And especially as we get older, joint mobilization, I think, becomes even more of a priority in our self-care practices, because we spend, you are what you do, right? You are what you think, you are what you do. And if you sit all day long, if in a 90-degree angle at your hip joints and a rolled, rounded posture with your chest and your hands are out in front of you on a keyboard, and you do this for, 8 hours a day for 40 years, you're going to have a pattern in your body. And so, whatever we've done for all the decades of our life, whatever kind of patterning we've cultivated, oftentimes as we age, our patterns get smaller, that we don't have as big and free of movement as we did when we're younger. And, you could go into lots of reasons why this is, but the important thing is that we want to maintain as much joint mobilization as we possibly can, so that we have the capacity to be free in our bodies. So when we joint mobilize, that just simply means rhythmically moving a joint in a pattern of movement. And we increase circulation. So that's first and foremost. We increase circulation throughout the joint. We loosen the fascia and all of the connective tissue that is a part of that joint, which helps us to feel more fluid and less stuck. And this one's important. We pump, if you don't know what synovial fluid is, it's the fluid that is inside a joint capsule. So, when you have your knee joint and you have your two bones kind of right up against each other, there's a few things that prevent you from smashing your bone on your bone and keeping the joint capsule spacious so that there's a lot of mobility in there. Cartilage is one of them. That's, one of our connective tissues, but also synovial fluid. So the fluid around the joint as we age tends to lessen, and it gets thinner instead of, a viscous, really good gel-like medium for our joints to float within. Um, Synovial fluid is a shock absorber, but it's also, very importantly, the way that our cartilage gets nutrition. So cartilage has no blood supply. And when we want, and nor do discs, in your spine. And when we want, when we have injury to these areas, or we want to keep them supple, we need synovial fluid to bring nutrients into that joint space for the cartilage to absorb. And when we move, when we have a mobility of a joint, any joint, the synovial fluid kind of pumps in and out of that joint really well. So we keep our cartilage and our joint spaces really healthy when we mobilize. And then the next thing, that it trains your nervous system. When we have joint mobilization, when we move through a joint, any joint in the body, we train our nervous system in its proprioception, like where are you in space and how do you relate to that space. And we also train the nervous system in the sense that the nerves themselves get some flossing and some movement, so they don't get stuck as well. So there's just so much goodness that happens from mobilizing our joints, and probably how we feel it the most, besides, this increased range of motion, is that we have more ease, we have more confidence in our movement potential, we have more responsiveness when we lose our balance, or when we have to do a sudden movement. We have more freedom in our body. We have more choice in our body. We have more capacity to move in different ways. And probably my favorite is that we just have more body joy. Like, it's important to have body joy, that you feel good being embodied. And when we mobilize our joints, it gives us that feeling of and ease in our bodies. So hopefully I've dangled enough carrots in front of you for why a practice like today's is important. And I find, I don't know, you'll have to tell me how you feel, but I find joint mobilization practices really fun and not too challenging in the sense of like, oh, now we have to do 100 squats or something crazy, right? It's a more gentle practice, but it's a very effective practice. And I think it's a great adjunct to any form of exercise that you're doing, including a standard yoga practice or any other form of exercise you're doing. As we age, especially, mobility is really important to incorporate in. Okay, so let's go ahead and find a comfortable seat, sitting up straight and tall. Okay, and um, as we close our eyes, maybe we can think about this full moon that's upon us and recognizing that the full moon in November, the frost moon or the beaver moon, as it's called, really symbolizes trying to prioritize our energy. Kind of being busy, getting ready for winter, but prioritizing what it is we need, what it is we don't need, what can be let go of that is not necessary to lug around. So as you reflect on your own kind of inner work, what are the things that you are prioritizing right now? How are you gathering resource for yourself? And I don't just mean offering food to the food banks this week. It can be material resourcing for us and others, but it can be also emotional resourcing. Where are you putting your time, your energy? What relationships are you feeding? And is there any subtle changing that needs to happen in that realm? The other beautiful thing about the full moons in fall is that we get to appreciate abundance and we get to, when the warmth and the light is changing and fleeting, somehow we can savor a little bit more. We can appreciate. So let's begin our practice here with just some gratitude. Let's bring our hands to our heart space. And can you have gratitude for all the abundance that you have in your life, your relationships, your health? Start to connect in with your breath. You can release your hands. Notice if your breath feels smooth or choppy, if it feels quick or slow, full or shallow. And whatever you're noticing as we begin to deepen our breath now, notice already the subtlety of joint mobilization that happens solely from the breath. Notice where the ribs meet the sternum and where the ribs meet the vertebrae, and check in with those joint spaces. Can you notice the subtlety of movement? When you feel ready, bring your hands together at your heart. And let's set an intention. Perhaps it's about prioritizing caring for ourselves and where we want to place our energy. Maybe it's about prioritizing our relationships and supporting those around us. Whatever it is for you. Release your hands and we'll find our way onto our back. All right, so as you stretch out and lengthen your body, what a gift it is to have some time in your day to take care of your mind body. So as we lie down, let's just have a moment to mini shavasana yourself. Let your ground support you. Okay. Feel the weight of your body ease into the ground. Now, when you're ready, stretch your arms overhead and let's have some movement here. Reaching one side, then reaching the other, finding some openness. Simple things like just moving your hips a little bit, moving your shoulders a little bit. Someone told me a story recently about a story they had read where prisoners, this is, many centuries ago, were forced to work all day in the fields. And let's go ahead and draw our knees into the chest and move, work hard all day long. And then at night, they were strapped down to a concrete floor or bench or something for their rest. And all of them said that the forced immobilization was way more difficult to endure than the hard efforting in the body. So think about that, the ways that we get stuck and we kind of self um, cage our immobility. Let's see if we can prioritize mobility as we practice today, recognizing that motion is lotion. Okay, so let's open up the knees away from the midline, bring them back in toward, and just go ahead and find a little bit of mobility in your hip joints. All right, and then right knee into your chest, left leg long on the ground, and let's roll around in our ankles. We'll start at the bottom and perhaps work our way up. We might skip some steps along the way, but let's start with the bottom of our body, our feet. So we do this every class, and there's a reason for it. Keeping your ankles and feet mobile is one of the greatest priorities for our aging mobilization. So feel any bit of swirling. Remember that repetitive motion is a great way to joint mobilize. So some circling or just back and forth motions, rhythmic motions of some kind. And then let's switch legs, left knee and right leg long on the ground, and keep moving your feet. Find a pattern you haven't found yet. Maybe wagging your feet left and right, or pointing and flexing if you are only rolling. See what you can find. And nice good squeeze of that left knee into the chest. And then we'll release that out. Starfish your body, a whole body mobilization. So much can happen in this simple posture of stretching outward and then exhale and drawing inward. Head and knees to chest. Think about how many joints you're rhythmically moving in this simple action. Stretch out spaciously. Exhale, draw in snug. One more time. Open your body up. Exhale, close your body up. Put your head down onto the ground. Put your feet on the floor, and let's windshield wiper our knees left and right. Simple beginnings here of just mobilizing a lot of joint spaces. Feel your hips, feel your pelvis, feel your SI joints, feel your low back.
All right, and then bring your knees back in toward your chest, a little bit of rocking. And we're going to open and close our knees now. So left leg straight and then right leg straight. Draw the other knee in as you go. Waking up our core as well, waking up the mobility in our hip joints. Focus on the backs of your knees, getting broad as you straighten that leg, feeling that opening and closing through both the knees and the hips. Relax. Again, put your feet on the ground. Find your breath. We're going to inhale, lift up into a bridge, arms come up overhead, and then exhale and lower your pelvis back down, arms down at your sides. See if you can ripple through your vertebrae, noticing each one as you lift into the bridge, and as you exhale, bringing your arms back down. One more time. Feel how your muscles support mobilization, that it's not just totally passive, that there's some muscle engagement involved in moving your joints. All right, relax and melt back down. Let's take your right foot and right knee in your hands. So like you're moving in toward a reverse pigeon. Left hand holds left hand holds right foot, right hand holds right knee. Do some circling in your hip joint within the external rotation. So you're keeping your leg like a pigeon and rotating in that hip joint. Just drawing some circles. And then relaxing that foot down onto the ground. Switching sides. Left hand on left knee, right hand on left foot. Circle this side. When we do bilateral things, or unilateral things rather, notice discrepancies. Notice like this hip for me feels very different from my other hip. How about for you? Do you feel subtle changes, subtle differences? And see if you can figure out, how does this pattern show up in your body? Why does one hip feel differently than the other? What kind of movement patterns have you set up in your body? And then release your legs, stretch your limbs out to a star again. Exhale, knees into your chest. All right, release your head down onto the ground, arms out to the sides. We're going to stretch our legs straight and wide. So take your legs off the mat so your feet are a little wider than your mat. We're going to turn our legs out like ballerina, so toes turn out. Drag the heels in towards your glutes, and then turn your knees toward each other and push your heels back out. So we're moving through some internal and external rotation in the hip joints now. Drag your heels in while your knees are close, and then turn your knees out and push your heels away. So our heels have a slight drag on the ground as we keep spinning from internal rotation and external rotation. So this, grabbing of the floor with our heels offers a little strength into the muscles surrounding our hip joints. So notice if you get any cramping in your feet or in your hips rather. And then relax that and bring your knees back in toward your chest. Roll to your right side. You can always support underneath your head if you'd like with a blanket or a block. Palms together, knees together to begin. We're going to open up the book, slide open to a twist, let your knees come apart, turn your head, palm down on the, or back of hand on the ground, and then come back. So we're mobilizing the spine now a little bit as we open and as we close. You can move with the breath, you can move faster than the breath. Just make sure you're breathing. And then we'll roll over to the other side. Bring our hands together, start with your knees together, knees are bent. Slide open, turn your head, open your arm behind you, and then bring it back. See if you can touch the back of that right hand onto the ground, turning your head all the way right and back again. And just notice, again, the differences between turning left and turning right. We're doing, we've now done both sides. Is there, do you have more range of motion turning your head one direction or the other? How are you? And then we'll spread open our wings again. A big giant star. Roll your wrists, roll your ankles. And then draw your knees into your chest. Pick up your head. Rest your head back down. Grab your feet. Happy baby pose. A little bit of rocking, opening up the spine here. And then we're going to straighten one leg a little bit and then tip to the other side and straighten the other. It's just kind of going back and forth with opening and closing our knees again. Relax, open to a star. Stretch your limbs wide. As you exhale, roll onto your side and curl and tuck to a little ball. Inhale, slide back open to a star on the ground. Exhale, roll the other direction. And we'll do one more each side. Let the shoulder have a big sweep. Roll to the other side. And one more time to the left. Expand open to the star and roll to your side. Back onto your back. Reach your arms overhead. Feel that full body length again. And then cross your arms over your body. Legs are straight on the ground or knees bent, feet on the ground. Inhale, open your hands out, palms on the ground. Exhale, cross your arms the other way. Open up and cross. Let's roll to our side and come up to your hands and your knees. As a hospice nurse, I think most of you know that that's been a big part of my professional journey. One of the things that I always find is when older people, elderly people, get very stiff in their bodies, not a lot of good things come from that. Okay, and when you see older people, let's move through some cat-cows. When we see older people who keep their joints flexible, mobile, I should say, not flexible, mobile, where they can move through a full range of motion, there's a little bit more ease in their bodies. There's a little bit more capacity. So let's tend to this skill within us so that our 100-year-old self can very much thank us for our mobility practices today. All right, let's rock a little bit. Wag your tail. Okay, move your head around. Any kind of swirling like a fish that you want to do. And then stretch back toward a child's pose. Walk the hands far out in front of you and lengthen. Breathing deeply. And we're going to come up to round the spine like a scared cat. And then open the chest like an old cow and come back to child's pose in that position. And then round up again. And then arch your back and drop back to a child's. One more time, round the spine up. And then arch the back, anterior tilt the pelvis back to a child's pose. Walk the hands over to one side or the other. And we're not going to stay in this position in a stretch like we usually do. Inhale, lift up on hips over knees, and then exhale back into that side stretch. Up onto the knees a little bit more, and back. One more time. Hold that position now and breathe. Take a deep breath. And come back to the other side. Walking your hands over, feeling that side body stretch. Secure your knees. Make sure you're in good placement for movement. And we'll come up onto our knees a little bit higher with your pelvis and back down. We're staying in that side stretch as we go. Be very mindful that this is a little more challenging on the spine than just moving in the neutral spine. So take care of yourself. Only go into the range that's healthy for you. Now we'll stay. Breathe here. A full big inhale and exhale. All right, come back to center. Wiggle your spine around again. And this time, pick up your feet and let them swish from left to right. And then we'll drop, put your feet back down, drop your hip all the way over to one side. Back to center, hips all the way over to your other side. One more time, all the way over to the right. And then all the way over to the left. And lift your left arm up in the air. Let's roll your wrist around while we're here. Rolling through, maybe open and close your fist. And then we'll take our twist. Finding your breath. Now the movement we're going to find here is a little rocking forward and back. So kind of lifting your hips up and dropping them back. Right. Face the ground a little bit more instead of the twist. Open up that shoulder and then we'll lift arm to the sky, rolling your wrist around again. And then place that hand down onto the ground. Second side, right arm up. Roll your wrist around a few times. Maybe open and close your fist. And then take that shoulder under. Find the depth of your pose, and then if you'd like to invite movement, a little bit of rocking. Right. We'll face the ground a little bit more. Just open up the back side of that shoulder. You can even do a little more rocking here if you'd like. And then we'll inhale, reach that arm up, a moment more of some wrist rolls. And then place that hand down onto the ground. Find your way as we climb up into a dog pose and come off the ground a little bit. Let's see what it feels like to move and mobilize our feet. So dropping one heel, bending the opposite knee, back and forth. You don't have to go super speedy. Just allow a rhythmic movement, opening up your calves, feeling the bottom of your feet, noticing any nerve sensation that you might feel. Full breaths here. All right, and then walk your feet forward and come to an Uttanasana. Forward fold, give your hips a good shake, give your head a little bit of a shake. Feel free to bob or bounce a little. This is also really good for our joints to have that compression, decompression. All right, inhale for a halfway lift, opening up through the spine. Let's pedal your feet while you're here. So hands can be on blocks if you want them to be. Start to move your hips a little bit. Let your hips draw, but one hip draw back as you take that heel down, bending the opposite knee. And then find your way into an Uttanasana. Inhale for a halfway lift. Sit bones high. Exhale, bend your knees, release your head. One more time, a halfway lift. And then relaxing. Push through your feet, rising up, bringing the arms to the sky. Lean back a little bit if it feels nice to do so, where we have this sense of space. And then we'll start to mobilize the shoulders a little bit. So open to a cactus, and then round in chin, chest, arms together. A big sweep, and a drawing in. Notice much of this we do all the time. I really try to incorporate mobility practices into our yoga practices. All right, now press your hands away, and let's start to invite some nerve glides into our mobility. Drop your fingers, point them down, lift your fingers, point them up. Okay, just a little bit of back and forth. You can circle your wrists if that's preferable. Okay, maybe even, like turn, let's see if I can get closer. Turn your palm up and do some, coming forward with your fingers. Okay, like you're inviting someone, like, come on, come to me. Come both sides. Okay, and then release your arms. A big arm swoop up and down. Relax and fold forward. And let's ripple our spine upward. Do a few shoulder rolls here, rolling your shoulders back. Notice if there's any crunchy, any joint space that you get to. Notice if you have a lot of crepitus in your joints anywhere, that cracking, crunchy sounds. Roll the shoulders forward. And then give your hands a good shake. Okay. Shaking does a lot of mobilization for your wrists, your forearms, even your elbows. All right. And we're going to just do a little bit of lateral movement. So we're going to turn a little bit toward our one leg and then lean down and roll back up through the other side. We're going to go both directions. So either way, you start. Use your core, use your bent knees. Try not to rely, we're mobilizing on the back, the spine, but we're not relying on the back to do all the efforting. Now the other way. Laterally bend, lean over that one leg, roll to the other leg, and push yourself back up. If you're dizzy, which can happen, just stop. You don't have to do, there's way too many choices for you to do something that doesn't feel good. Find your way back. Let's have a little teeny bit of bounce. See if you can let the shock absorption, this synovial fluid feedback loop that we have, the more we kind of give a little shock to our joints, the more our bodies are going to learn to accommodate by having a lot of fluid in there to support us. Ah. All right, and then find your breath for a moment. Let's move our neck just a little bit. So half rolls. Don't do a full roll. We're going from stretching our ear up and then rolling our chin forward to stretch the other ear up. And then go back forward. Don't go backwards. Just go forwards. Mobilizing our neck. And then lastly, a couple of lion's breath, kind of facial movements. So we're going to open up our joints and our jaw joint. So stick your tongue out and down and look straight up. Ah.
and then release it. Don't hold for too long. We're just mobilizing. We're not holding a static hold. You can make some noise as you stick your tongue out and look up. All right, and then relax that, and we've almost gotten everywhere. Okay, lift your chin, touch your teeth, stretch the front of your throat, and then just a teeniest bit of movement left and right. Inhale, rise up, arms to the sky. Exhale, floating forward. Notice if you're feeling good. Inhale for a halfway lift. Melt and fold. Take your left foot back, come to a lunge. Ground yourself. Let's open up the hips in extension now. Go back and forth here. Starting to open up that sciatic nerve a little bit. One of the most important mobility exercises we try to do all the time in our yoga practice is this. Bring your back foot forward, fold. We'll switch sides, take the other foot back. And start to move here. Bending and straightening. Think less about, oh, I want to stretch my hamstrings, and more about just feeling extension and flexion in your hip joints. Flexion and extension in that front knee joint. Bring your hands down, step back to a dog pose. Finding your breath here. A deep breath in, a deep breath out. Come forward into a plank. Subtle here, subtle. Push the ground, spread your shoulder blades, bring your shoulder blades toward each other. Push the ground and just slide the shoulder blades on the back a little bit. And then we'll put our knees down onto the ground. Slide your way forward onto your belly. Take a cobra pose, open chest. Exhale, release. Mobilize the spine, rising up. Exhale, releasing down. Come up onto all fours. Moving around in your hips again. We'll move the blocks out of the way for a moment. Take your left leg straight back behind you and a big circle forward with that knee. So, lifting the hip high, drawing a full big circle with that leg. After 3, we'll change directions. Draw the knee in, out and around. Big circles with the hip joint. Stabilizing with your core, that left shin, it's not without effort. After you've done 3, we'll switch sides. The left leg or right leg straight up in the air, press your left shin down. Okay, knee out, up toward your armpit, and then underneath you and back. Do 3 big giant circles with your hip. As big of a circle as you can find. Your core is engaged, your shin's engaged. Switching directions when it's time. All right, relaxing that. Let's come to sit. Take your hands behind you to support you. Your feet are on the ground, knees are bent. 90-90 stretch, okay? So just dropping the knees to one side, dropping the knees to the other. Simple, not always so easy. Notice if your legs go if one leg internally rotates better than the other, if one externally rotates better than the other. Find your way back up to stand. Notice I forgot to mention this before we got up. Notice, this is just a good thing to notice in general. When you're stiff and you haven't been moving much and you try to get up off the floor, notice how many points of contact you need on the ground to get yourself up. And then now that we're feeling mobile, the next time we get up off the ground, try to pay attention if you need less points of contact, less support to get yourself up. Maybe when you're down and you feel stiff, you're like, oh, I need the floor, I need a couch, I need, lots of things to help me up. And then maybe when you're more mobilized and you're on the floor, you can just get up without having to touch the ground, or any variation. Just notice your subtleties. Okay, so while we're here, let's grab one block. You need a wall for this perhaps, or a piece of furniture. Stand your right foot on the block and hold on to something. So it could be a piece of furniture or a wall. Okay. All right, we're just gonna do some nice big leg swings. Use your core a little bit so we're not without stability. Mobility does not mean no stability. Okay, so stabilize your body as you swing your leg through. And then we'll turn, put your other foot on the block, and now we'll swing that leg. Breathing. Holding on to something just makes this a little safer. Make sure you're stabilizing with your core. All right, and then we'll come back to stand. We're just going to do some lateral movements. So take your legs wide, breathing deeply, and we'll just move very simply at first. We're going to add more to this, but just very simply notice some weight bearing, notice the other side, and just pay attention to, what's happening here. Now, as you go, depending on your hips, your knees, your ankles, you might find that, ooh, I'm only about here. So gaining mobility doesn't mean bypassing pain signals. So if you have a red light, pause, stop. Don't go past your red lights in the search for mobilization. Stability comes before depth, always. Okay, so if you get somewhere and you're like, whoa, I'm wobbling, or I have pain, that's your range that you're going to stay within. And it's okay if it's not where you want it to be, but it's where you are right this minute. Okay, so you stay in the range that's available to you without putting your hands on the ground. Okay, so a lot of times we can get down here and once we're down, we're okay. But when you have to be self-supporting, it can be more challenging. Okay, so we're going to come into the depth that's available with no hands, and then come back up and go to the other side. Okay, so don't worry, move slow enough where you really sense, especially your knees, you really sense, am I stable? Do I have support? Am I okay in this range? And just stop when your range is at its limitation. Okay, so see what you can do with no hands. Come back up in between. We're going to do a slide from side to side in just a minute. And you can do whatever you want with your arms. Your palms can stay together. Try not to lean all the way. We're not leaning down with our torso. We're staying fairly upright. And you might notice that one leg is stronger, more stable, more capable of supporting your body weight than the other. And that's okay. Just pay attention to your pattern. All right, now we'll do some full body, getting our spine and our shoulders involved in the movement too. Okay, so we're going to start here and we're going to sweep across. So stay low. We're sweeping across the floor. Getting a little deeper into the hip flexion. And now we're gonna come up like, we're wiping off a table. Find your breath. And now we're gonna come up into some big shoulder movements. Big spinal movements. Be where you are. Don't go past where your body is saying to go. Pause at the top. And we'll go the other way. I feel like I'm going kind of rapidly for what I normally do. Usually when I do this, I go a lot slower. I'm not quite sure why I decided to go faster. You take your pace. All right, and then we'll pause at the top. Finding your breath. Release your hands down. Okay, ground through your feet. Inhale, arms up again. Exhale, sweep your arms under. Shoulder movements here. Elbow movements. All right, and pause. Heel toe your feet in. Let's find a dog pose. I know sometimes mobility practices, when there's a lot of up and down, can make you dizzy, so be very mindful to take good care. Walk your feet forward. Come to Uttanasana. Relax your head. A halfway lift again. Melt to fold. Climb up. Okay, we're going to take our left foot out in front of you. I can show this from the side. Okay, we're going to swoop down. Okay, like this. This is a great sciatic nerve glide. So the front heel, the front leg, the heel is down, the toes are up. We're going to bend our other leg, but keep the front leg straight. Again, slow, a little faster, kind of find what works for you. Put back down, changing sides, other heel forward, and we'll bend into the knee, keep that front leg straight. How's the breath? Notice if you want to hike a hip out or do something weird with your pelvis. Keep your pelvis neutral. We're straightening that front leg, lifting the chest. We'll come onto your feet and we'll lift up onto our toes and back onto our heels. So notice as we have progressed, we've changed from taking poses in range of motion that's not weight bearing to taking poses that are in weight bearing, range of motion in weight bearing, and how different those feel, even in the same motion. All right, ground yourself. Notice your body and breathe. Okay, we're going to grab a strap. You want to take it as wide as you need it so that when we come up and over, you're not doing this. You're not like one arm forward, one arm following. So you want to have, symmetry as you do this, and you also don't want to have your back go way arching. You don't want to have this seesaw thing going on in your body. So stabilize yourself. Take as wide as you need with the strap to open up your arms behind you and then to bring them back. Go kind of slow. Slow your roll if you're being speedy so you can really sense relaxing your neck, not taking the tension in your neck. This is a great way for you to also notice discrepancies between the two sides. Notice, having this range of motion, how different it feels when we have to lift against gravity or versus when we do some range on the ground. Okay, so pause. Take your arms up. Cross one over the other. And we're going to bend and drop. And then inhale. Lift the elbows, the teeniest bit of back bend. Exhale, round just a little bit. Inhale up. And then rest in this pose. Okay. Reach the arms up. Let's take the arms the other way. Other arm on top. Drop your shoulders. We'll bend our knees and just release downward a little bit, broadening your back. And then inhale, elbows up. And then pause in eagle arms for a moment. All right, release your arms down. Give your hands another good shake. We'll move through one vinyasa. A deep breath in. Rising up. Exhale and floating forward. A halfway lift. Opening up the back line of the body. Exhale and release. Back to a dog. Find your breath here. Yield and push and reach. We've spent very little time in traditional postures today. Enjoy one. And then come forward into a plank. Support yourself on the way down. Any back bend you want. Release to melt. Take your left knee up high toward your armpit. Get rid of your blocks if they're in the way. And we'll cross that arm over and roll open into a twist. And again, if you want a little rocking in this pose, feel free. If you want to be still, feel free. If you want to move your arm around, feel free. Relax. Coming back round, we'll switch sides, bring that knee up. A full breath. And then cross the arm underneath you and roll open. What do you want? Do you want stillness? Do you want movement? Sometimes I push off my toe to rock a little bit. See what feels good for you. What makes your joints happy? Come back onto your belly, up onto all fours, and stretch back into a child's pose. Rock a little bit if you'd like. Let's come onto our back. Is there a pose you'd like before Shavasana? Do you want a happy baby? Do you want a reverse pigeon? Do you want to put your thigh over your thigh and draw your knees in?
Do you want to be still? Do you want to be moving? Do you need like a leg up the wall kind of feeling? Do you need a bridge? Do you need any support? Okay, so just always learn to listen to your intuition. Okay, if you allow it, your body will tell you what it wants. Half the battle is just paying attention, just listening. Feel free to rock if you want. Some rocking plow might feel really mobilizing for your spine. All right, and as we prepare for Shavasana, make sure you end in a soft movement pattern. So let your body kind of find gentleness, softness, easeful movement as you ease your way into Shavasana. Maybe your last mobilization can be a little rolling through your ankles, toes, wrists, fingers, turning your head, getting the edges of your body to know their freedom one more time. And then drop your body weight down. How lovely it is to be able to move. Let's just never take for granted and have such deep appreciation for our mobile joints. Let your breath get deep and steady. Let your limbs drop wherever you're comfortable. when you are ready to move again, first the breath, first the breath. Notice if your body is more free to receive your breathing. And then any kind of movement that works for you. Where's your spot that you want to free up first? Getting out of Shavasana is not the place to try to have least points of contact on your way up off the ground. So practice that later. When you come out of Shavasana, roll and rest. And then gently use your arms to help you come to a comfortable seat so that you're not exerting yourself. Be as gentle as you can with your body. And as you come to a comfortable seat, notice how you feel. Is there more room to breathe? Do you have more ease? Have you had any moments of body joy in the last hour where you've really savored sensation? Do you feel grounded? How do you feel? And then when you're ready, we'll bring our hands together. And if part of our prioritization is kind of shoring up our sense of community and relationships as we move into this darker season of the year, let's pull on one of these chords by offering our energy, our support to another. Namaste. Thank you, everyone.